All right, let's go ahead and begin. So first, I'll start off introducing myself. I'm Tiffany Tripathi, the chair of WISH, and I am delighted to present our speaker and fellow WISH member today, Laura Hennum. So what is WISH? WISH stands for Women Investing in Samaritan Health. It's a branch under the Good Samaritan Hospital Foundation. WISH is a giving circle, meaning a group of individuals that donate their own money or time to a pooled fund, then decide together what projects to invest in. WISH was founded in 2004 and is open to women and men interested in supporting the health needs of women and children in the Corvallis area, both their physical and their mental health. We provide the support through funding grant requests to staff that are affiliated with Samaritan Health clinics and Good Samaritan Hospital. Many of these requests would not be possible otherwise through regular department budgets. Our giving members vote and approve funding of special equipment and programs impacting women and families. In addition to this, WISH sponsors a variety of local events to bring women together for fellowship and networking, and also education events for community outreach focused on women's health. Of course, this hasn't been easy to do during the COVID pandemic, and it's currently mostly virtual events, and we can't wait to meet in person, but we are finding ways to get creative. This past fall, we were thrilled to show our appreciation of frontline staff by delivering cookies and local apples to the Corvallis-based departments of Samaritan that directly impact women and children's services. It should be noted that there is another giving circle, the Pacific Health Communities Foundation has a women's giving circle, and they also support healthcare for women and children within the context of patient care at Samaritan Pacific Communities Hospital in Newport. So why am I excited about WISH? I've seen uphand the profound impact of, say, a rift in activity chair, as the therapists are now able to provide pediatric patients with targeted therapy to have that adjustable seating to serve children with complex physical needs. It's because of the women who undergo cancer treatments and receive custom lymphedema compression garments through Donabella to aid their recovery that otherwise couldn't afford them. It's the meaningful programs like Arts Care, who continues to find new ways of reaching members of our community that are struggling by providing music and art projects that promote healing and in turn support local artists. I've given birth at Good Samaritan Hospital before the labor and delivery bathrooms were remodeled, and I take pride in knowing WISH funded 2 of those bathroom remodels. And there are more remodeling requests still coming in that promote new moms within our facilities. WISH can provide this aid through annual membership dues and online donations, and the more contributions we receive, the more that's available in our collective pool to award each year. Being a member is also about fellowship and networking with other strong, compassionate Corvallis women, whether that's lunches and happy hours or delivering cookies to hardworking staff at Samaritan Health. It's about making a difference in our community and having the power to do something important. We do have an upcoming event if you're interested in finding out more. We have a fellow members event on January 27th at 3 o'clock. It's a good time to catch up and find out more about what we do and have a voice in what's coming in the next year. You can find out more at samhealth.org/wish. It's my pleasure to introduce Laura Hennum today, the CEO of Good Samaritan Regional Medical Center. Laura joined Samaritan Health in August of 2020, right in the middle of a pandemic, and has been instrumental in Good Samaritan's response efforts during this challenging time. She brings 25 years of prior leadership experience as the regional CEO of Southern Nevada, working jointly with Emrys and Dignity Health to expand healthcare offerings, while splitting her time in Tacoma to open 3 new facilities with MultiCare. Other roles include Chief Strategy Officer for Dignity Health and leadership roles across Central and Southern California. Laura is an Oregon native, growing up in Portland and receiving a bachelor's degree in communications from Washington State. She also has a master's degree in health administration from Virginia Commonwealth University. It was in part Samaritan's concentration on philanthropy that brought Laura to Samaritan Health, seeing how the foundation responded to COVID and wildfires in aiding the community and our employees. Laura has held key philanthropic roles for more than 15 years, having a direct relationship with foundations as a major donor. Thank you too, Laura, for being a WISH member. And I'll kick things over to you.
Well, thank you so much, Tiffany. That was a very kind introduction. And I am a very proud WISH member. And as Tiffany said, I have prided myself on being an active donor. I'm an active donor for Good Samaritan Regional Medical Center in addition to being a WISH member. So I want to thank each of you for taking time out of your day to join me virtually, to join us virtually. I want to make good use of our time. So I would like to just pause for a moment. Not that any of us are maybe in a rush to look back at 2021, but I think it's always important. I know many of us feel the same way, kind of thinking about what are the lessons that we can take forward. And for those of us who work in healthcare, my takeaway is really thinking through how can we not only refresh ourselves, build resilience, but how can we recommit ourselves to healthcare? Because I actually can't think of a more meaningful time to be working in healthcare, and that as challenging as the pandemic has been, there is still plenty of hope. So I want to talk about all of those things, and maybe just to kind of level set us, take a few moments to talk about where we are locally with the pandemic. All of us watch the news, hear the news, read the news online, and we know nationally the Omicron variant is certainly taking its toll. Unfortunately, Benton County is feeling some of those effects. So what I'm sharing with you here is just a quick snapshot over the past 2 weeks, what the number of cases have looked like and that increase over the past 2 weeks. So if you look down kind of just left of center on this sheet, you'll see that blue curve, that blue arch. And what that represents is the increase in the average number of new cases per day. So it's a little bit eye-popping, but I think it's important to kind of, understand the landscape in which we're navigating right now. And that is a nearly kind of straight upward trajectory in terms of the number of new cases identified per day. So it has jumped over the past 2 weeks from about 19 and a half new cases identified of COVID-19 each day to 146, a touch more than 146. So that is a very dramatic curve. And as I said, if we were looking at it as a growth trajectory, it would be nearly straight up. Then on the brown curve just to the right of the center, these are the number of people who have been diagnosed with a COVID infection over the past 2 weeks. So you can see 2 weeks ago that number was at 273. Now that number is at more than 2,000. And then that graph below is a little bit difficult to read just because the numbers have grown so exponentially. It throws the scale off. But again, that's just directionally showing us, that's the breakdown by age. So what we're now seeing is we hear a lot of news reports about these are less severe cases, much more contagious. Unfortunately, it becomes a bit of a giant math problem, doesn't it? Where when you have that many more people infected with the virus, it's just going to increase the number of folks who not only are testing positive, but unfortunately who are still suffering from severe cases of COVID-19. And thus we get into this position that we've been continuing to manage at Good Sam of how do we balance that influx of COVID-19 cases. We're also seeing a lot of demand for healthcare services, rightfully so, because folks have really tried to suppress, if you will, kind of the pent-up need for healthcare services. And so what we're balancing and always balancing and should balance is what are we doing to help mitigate, manage, care for patients during this global healthcare crisis, and at the same time provide the healthcare services that our community needs on a typical basis, and not letting those key health needs go ignored. So really those are the guiding principles for us right now at Good Sam. So this just gives you an idea. This is the most recent data available, so January 17th, shortly before midnight, grabbed where we are in terms of our overall hospitalizations with Good Sam. So if you look to the far right, this just tells you the number of patients who are currently hospitalized on each given day with COVID-19. So what this is showing you is that we're running at right around 25 in recent days, 25 COVID-19 patients we have admitted here at Good Sam. Happy to say, of course, we don't want to see any COVID-19 patients, but I am happy to say that right now we have 19 patients admitted to our hospital with COVID-19. That does represent a decrease over our peak with the Delta variant, which was a total of 33 patients admitted on a given day. That was the highest on a daily basis that we saw at Good Sam. 33 patients who were admitted in late September. So while much of the state saw a peak with the Delta variant in early September, we saw it in late September. Right now, Oregon Health Sciences University, and I'll touch on this in just a bit, is predicting a surge, the peak of the surge with the Omicron variant. They're predicting that we will hit that peak on January 27th. So I'll show you a little bit about that data as well. I get a lot of questions from members of our community as well as from our own team here at the hospital. What are we seeing in terms of the percentage of individuals who are hospitalized who are fully vaccinated as compared to those who are not? So what this graph is showing you is that the number of patients in that lighter purple kind of violet, those are the number of patients who are currently hospitalized, again, on a daily basis. So you can look at it retrospectively as well as to date on the very, very far right. So capturing on a daily basis how many patients who are hospitalized. The light violet represents those individuals who are not vaccinated. The dark purple at the bottom represents those who are vaccinated. If you look in the upper top right, you can see it's nearly 17% of our admitted patients with COVID-19 are vaccinated. So the majority still, the patients who we're caring for with COVID-19 who are unvaccinated still make up the majority of our patients that we're caring for with COVID-19. And I think I saw a comment in the chat. I want to make sure. Where do we see these charts? We actually report on our website each day how many patients we have for each given day, how many patients we currently have admitted with COVID-19. I would have to go back and take a look. I'm not sure if we are indicating what percentage of those are vaccinated versus unvaccinated. I think we have a little bit different chart that shows by symbols. They're symbols of human beings, how many who are vaccinated as compared to those who are unvaccinated. So kind of graphically tells the same story, but just in a little bit different graphic depiction. So I grabbed this information. I thought it would be of interest to those who are on the call today. This is representing to us as of January 7th. They unfortunately had not updated this information. This is available through the Oregon Health Authority, and I'm just grabbing this directly from the Oregon Health Authority's COVID-19 dashboard. So you can see all this information. Actually, I'm hopeful by now it's updated. But as of January 7th, this shows the number of individuals who are currently hospitalized, again on a daily basis, hospitalized with COVID-19. If you look in kind of roughly the vicinity of Benton County, we are included in what's referred to as Region 2. In Region 2, I've listed it here, Benton, Lincoln, Lynn, Marion, Polk, and Yamhill counties. And so on January 7th, we had a total of 114 hospitalizations. I was able to get a little bit of an update directly from the Oregon Health Authority that more recently we were running at about 125. The blue line represents Region 1. Region 1 includes Washington County, Multnomah County, Tillamook County, as well as a few other counties, kind of that upper northwest corner of the state. They're running considerably higher. They're close to 400 patients hospitalized with COVID-19. Salem Hospital, unfortunately, is seeing the highest number of COVID-19 admissions currently. Good Sam, we run somewhere between 12th and 14th in the state. Not a race we want to win out of the 53 hospitals who are reporting. But of course, it's important for us to track on this because we know how impacted hospitals are through the state. We actually just accepted a patient transfer last night from Idaho. So we know how valuable this real estate is within each of these hospitals. So again, kind of understanding directionally what's happening. I also look at this looking for the beginning of a downward trend. And so that really takes us to what I'd mentioned before in terms of the peak. So this is also information that's available online from Oregon Health Sciences University. This is as of January 6th. This is their forecast for the state. So what we're looking at least as of their January 6th forecast, that they are forecasting that peak for January 27th. So the black line on the graph represents actual hospitalized cases, those who are COVID-19 positive and are admitted as inpatients in any hospital in Oregon. The yellow line indicates the forecast. So you can see a very steep upward climb followed by a very steep downward climb. So hopefully we maybe can get there sooner rather than later. Maybe the peak won't be quite as high, but unfortunately you can see the trajectory is staying fairly true to the forecast. So again, something we look at very closely. What I captured on the bottom left, I already mentioned that we peaked with the Delta surge at the end of September 21st. And then key parameters, some of the things that the forecasting team at Oregon Health Sciences is looking at, and I'm very grateful for the information that they continue to share with us, they refer to it as immune escape. So one of the things that, and I know it's a question that comes up a lot, that, you know what, I've been vaccinated, I've gotten both shots, I've gotten my one J&J vaccine, haven't received my booster, what does that mean? As compared to I have my booster, what does that mean? And I'm going to actually get into some additional narrative from the head of our infectious diseases team a little bit later in this presentation, but it's important to acknowledge that this immune escape or waning immunity is one of the things that forecasters are looking at very closely with the Omicron variant. I've had individuals say to me, I've been vaccinated, I shouldn't get infected. And what Pfizer, Moderna, J&J have said all along is that what the infection does is that it really works to mitigate, prevent, diminish death or hospitalization. It really is looking to make it a less severe case. So this is one of the things that Oregon Health Sciences has shared, is that while the vaccine or the boosters do not prevent infection, the goal, of course, is to mitigate or diminish the severity. And you, of course, are more protected with the booster as opposed to if you've only had one or two of the COVID-19 vaccine shots. So just, you know, it can be frustrating, but one expert shared with me, and I really liked the way that he put this, is he said, you know, when we're developing science, it's messy. And right now with COVID-19, we're developing science. And so sometimes it can feel like there are so many unknowns, but the fact of the matter is that this is still evolving, this is still taking shape. I read a great article for those of you who may subscribe to the Wall Street Journal. I know it is an article that you can find online from the Wall Street Journal. They wrote a pretty lengthy piece about comparing COVID-19 with the flu pandemic of 1957, and they were comparing and contrasting and really asking some key questions that I appreciated about, well, what was different? Why did it seem like we were more resilient, that we were able to move through that quickly? And they pointed out a few key things that I thought are worth sharing with you and I think are worth hanging on to. One was, you know, we all hear about the shutdowns and, you know, restaurants, businesses, schools, you know, everything being shut down. And so the researchers who had put together this particular article asked, well, why is it we didn't shut down businesses or schools or do all the things back in 1957 that we're doing in 2020, 2021, and now into 2022 to a certain extent? And so what they found in 1957 that, you know, we can work remotely now. There's so much that we can do remotely. That wasn't an option in 1957. We had the telephone, but that was pretty much about it. And so folks didn't really have the option to work from home and do so many things from home. You know, we know the internet didn't exist, so the options just weren't there, so they kind of continued to soldier on. There was also a broader acceptance that once the flu vaccine was identified, it was shown to be effective, there was a very high compliance rate with it right away. And then the other thing influencing kind of the shutdown of businesses and schools is that at least based on the population that was in place at the time, we had more than an ample supply of hospital beds. One could argue we had way more hospital beds than we actually needed. So it was not a hardship for hospitals. It was not a hardship for a given community if a higher number of individuals were hospitalized. And many of them were hospitalized with the flu for 3, 4, 5, 7 days. And so a lengthy hospital stay was not problematic. Beds were available, staff were available. Now you fast forward to the 21st century, we do not have nearly the number of hospital beds per capita that we did back in 1957 relative to population today as compared to the population then. And that really resonated for me because one of the things, of course, that we track very closely on at Good Sam is that unfortunately Oregon ranks last in terms of the number of beds per 1,000 population. We share that ranking with Washington State, not that it makes us feel any better. And it happened for good reasons. So much has moved to the outpatient arena. We've become much more efficient. Unfortunately, when you find yourself in the midst of a global pandemic, a community health crisis, it creates this kind of recipe that we're seeing now where you hear and you read and see the news reports that talk about overwhelm in hospitals. So very, very different, but I thought it really interesting comparing that to what was happening in 1957. And Elvis did go on television. He got his flu shot on live television, encouraging people that if it was good enough for Elvis, it was good enough for them. So that was the other kind of interesting tidbit from the article. So this goes back to the Oregon Health Sciences University forecast. So this is just showing us again that upward, very dramatic upward trajectory with the test positivity. This indicates that it is in the high 19%. I know we're now well over 20%, which is a combination of a number of factors. Of course, the Omicron variant being highly contagious, much more testing going on, and of course kind of moving away, as I talked about, kind of touching on businesses closing down, maybe people not utilizing masks in the way that they were. So all of that driving up that test positivity rate. Then you contrast that with the total number of tests, and this is where it does get interesting. Now as we see, and of course anyone can request a free COVID-19 test from the U.S. government. The state, I know, has ordered 12 million at-home self-test kits for COVID-19. So what's being captured here are the tests that are being administered through hospital or clinic or public health sites, retail pharmacies, a number of areas that have been doing testing. Now experts are indicating we may actually be undercounting the testing, still reflected in the positivity rate, but not necessarily reflected in the testing rate. So we may be understating right now what's happening with total tests because what OHSU is indicating is our total test is roughly equivalent today with what was happening during the Delta variant surge in summer into the fall. So all of these things continue to influence how we're caring for, and now the focus being much more on those individuals who are symptomatic, who may have severe illness, and there's debate about how often we should test. There are many health experts who feel that we're not doing nearly enough testing, and then there are other experts who feel that we're not doing enough. So again, this is the science that's being created. This is the landscape that we're navigating right now. But for me, I feel like any information that we can gather that at least can kind of directionally give us a sense of what may be going on. And that's why I think looking at the total test and the positivity rate together is critically important. This just touches on vaccination rates. For me, what was interesting about this was looking at the fact that they broke it down, kind of the one dose, complete dose, and then that extra dose. And because our vaccination rates are moving so quickly along with the positivity rate, this is something I try to look at as often as possible. This is now dated information, having pulled it from their January 6th forecast. But still, I think for me, just understanding where we're going as a state is important, and for me, any upward trajectory with vaccination rates is a good thing for our hospital, all of our hospitals. And then I did want to give the group insight into what's happening internally. I know there was a lot of discussion about the Oregon vaccination mandate for healthcare workers. We certainly complied with that. And if you look at the GSR column, this is showing you the vaccination rates across all of our sites. And just focusing on GSR, which is Good Sam Regional, Good Samaritan Regional, just for a moment, if you move down that chart to the percent total vaccinated, 92% of all of our employees are vaccinated. So then you ask, well, wait, what about that other 8%? That other 8% captures a combination of remote workers. We do have a number of remote workers who never have to come to the hospital, billing, transcription, coding. There are a number of areas where they don't necessarily have to be inside the hospital. So it includes that percentage or that number and that 8%. It also includes those who received a medical or religious exception, which is acceptable under the Oregon vaccination mandate. We know there's lots of discussion relative to the federal mandate. We also have been following requirements provided by CMS. So at this point, even though that there is some judicial debate on where some of those mandates lie, we are fully compliant with the Oregon vaccination mandate, and pleased that we have 92% of our employees at Good Sam currently vaccinated. And I did want to highlight the good work that Benton County Health is doing along with the Oregon Health Authority, along with the public health departments from Lynn and Lincoln County as well. They continue to work with FEMA to provide these vaccination opportunities. So I think it's incumbent to share, again, for those who are eligible, I think we need to continue to share information that this is the best that we have available and want to do our part to combat this community health issue. So great that they're continuing to offer these opportunities for those individuals who do wish to get vaccinated or need to get their booster. So one current or one recent change at Good Sam, so if you come to Good Sam, and I think it's always useful to know what's going on in the hospital, whether you're expecting to be here or not, because folks may end up here as a patient, or you may want to visit a loved one who is here as a patient. So currently we do allow one visitor and we allow one support person. So that is something we manage, and again, it's just an effort to do our best to contain that high level of transmittability with the Omicron variant. So because of the high number of cases, and like I shared earlier with the exponential, it's really stunning growth in terms of cases within Benton County as well as counties throughout Oregon, we implemented a new universal mask policy. We've never stopped masking since the start of the pandemic, so this is really kind of next level at this point. So if you can see the slide, you'll see down that left-hand side, these represent our old universal masks. So if you're familiar with kind of the traditional procedure mask, that's what we required of our employees. I'm here talking with you from the hospital without a mask because I'm in a private office by myself, door closed. Otherwise, I would have that center mask on, and that's our new universal mask. I'm not involved with direct patient care at the bedside, so this is the mask that I wear when I do round on the units, when I am out in the hallways, when I am in the cafeteria, when I am kind of out and about from the moment I come into the hospital. That is referred to as a non-fit tested N95. So that is now the new universal mask that all of us wear. And if we are involved in direct patient care, this is the mask that we would wear when we're not dealing directly with COVID-19 patients. Down the right-hand side is the part of our masking policy that has stayed consistent throughout. We have not changed our masking requirements related to those employees who deal with special contact, droplet, airborne precautions. And you can see that's kind of a combination of the fit-tested N95. You'll see that kind of strange-looking mask. It looks a little like a duckbill. We refer to that as a duckbill mask. And then that bottom right-hand mask is our PAPR. And so that's where you get the full coverage, the fully contained with the motorized unit, battery-operated unit at the back that fully contains all of the respiration. And of course, those who are dealing with our sickest patients, COVID-19, as well as other highly transmissible diseases, those PAPRs are used. For those buildings where no patient care is provided, of course, within Samaritan Health Services, we do have business office, we have our health plans, we have different areas where we are not involved with direct patient care. In that case, those employees can choose between the procedure mask or the non-fit tested N95. What I want to highlight here, and what I would highlight for those who are visiting the hospital, is there are no scenarios now under this new policy where we allow cloth masks. So that we did accept those under the old universal masking in buildings where no patient care was provided. Now we do not allow any cloth masks, even in our buildings where no patient care is provided. And I'm going to back up to where I was talking as well about, now I want to talk about visitors and the support individuals. Because we now no longer allow cloth masks, gaiters, homemade masks, you will be asked to wear one of our procedure masks. I've been asked the question, what if I'm a visitor, I have my own N95? Absolutely, will allow you to wear your own N95, whether it's fitted or non-fitted. What we probably will ask or suggest is that you wear the procedure mask over the top of it to preserve it. Oftentimes, N95s, we don't know how long individuals have been using a mask. We swap out our N95s on a daily basis. If they become compromised, if they become soiled, we swap them out. The really good news is we have an adequate supply. It's something we track on every day with all of our personal protective equipment. But when you come into the hospital or any of our buildings where patient care is provided, you will be asked to wear one of our procedure masks. And as I said, if you have one of your own 95s, we'll provide you with a procedure mask to wear over the top. But I know that individuals who may have in the past come in with a cloth mask, that was acceptable. That has changed now as we move through this Omicron variant surge. So what does all of this really mean? What it means, even though I talked about the waning immunity and some of the challenges, it isn't necessarily preventing infection. What the vaccines are doing is they are doing a good job of preventing serious infection or death. And so, again, that goes back to the news reports where folks talk about it's not as severe. We've got the vaccine now, whereas we didn't before. So very different than the beginning of the pandemic. Breakthrough cases are more likely, though, because of how contagious Omicron is, and again, because of just the sheer number of folks who are being infected at this point. And the booster is still a really, really good idea, again, to prevent that serious infection, hospitalization, or death. We do have more tools that are available to us now. There are a number of oral antivirals that have now received emergency use authorization from the FDA. At Good Sam, we are very fortunate, and I should have included a picture of it because it's very interesting. One of the Eugene news stations, KEZI, just ran a news story this morning about Dr. Brian Delmonico. He is an incredible intensivist, one of our ICU physicians, who has brought not only COVID-19 research to our hospital, but we are the only hospital in the Pacific Northwest that is currently using what is called the Seraph filter. And we use the Seraph filter. For those of you who may be familiar with dialysis, in some ways it operates much like that, where a patient's blood is being filtered, and the Seraph filter literally filters out the particles associated with the virus. It sounds very simple, but it is very complex. Dr. Delmonico has been kind enough to walk me through the process. It is reserved for the most severely ill patients where we've exhausted all other options. And what's incredible is we've used it on, I believe it's about 14 patients. 6 of them survived, and that's when no other treatment would have been available to them. So it's a true success story, and grateful that Dr. Delmonico is here and bringing that level of technology and commitment to our patients. And I've already reinforced vaccination, and appreciate folks' willingness to hear me out on that. Masking is a great idea. I was asked, and our hospital was asked by Benton County when they were reintroducing masking policies, not only inside but outside, and they asked us for our position. And one of the things I shared with them that I'll share with you today is that a mask is a very cheap piece of insurance. And so it's always a good idea. It doesn't hurt. And once you've worn a fitted N95, procedure mask actually feels pretty good after you deal with that. The N95s, both fitted and non-fitted, provide a very tight seal. It's really about that seal. So actually, if you're able to tolerate a non-fitted N95 or a K95, and I've got a photo of the K95 there, if you can tolerate that, it does give you a much tighter seal. Never wear it below the nose, always above the nose and over the mouth. And back to those FEMA-sponsored immunization clinics, it's great they now can provide vaccine to individuals who are 5 and older. All right, so I'm sure all of us are ready. I know many of us have been ready for a long, long time to move beyond COVID-19. We've got plenty of other things that I'd like to touch on in this latter part of the presentation. The only other thing I would say, yesterday was just a notable day for those of you who may be curious, kind of how long has this pandemic been going on? It was actually 2 years ago yesterday, so January 18th of 2020, when the first samples from individuals in Washington State went to a U.S. laboratory. 2 days later, so 2 years ago tomorrow, 2 days later, those were the first U.S. lab-tested samples that identified a COVID-19 case in the United States. So our odyssey with COVID-19 in the United States really started exactly 2 years ago yesterday. So looking at the CDC's timeline, it was the CDC who identified that first positive COVID-19 patient based on those samples that were taken 2 years ago. So an auspicious anniversary to say the least, but just gives us an idea of kind of how long that road has been. So when we get to a different place and when we get a break in the action, it's important to celebrate. And at Good Sam, I'm really happy to share that good things have been happening, in between how we've all been managing the pandemic. We recently received full reaccreditation from our accrediting body. So really proud of that. That's a 3-year accreditation. We went through an in-depth survey, again in the midst of COVID. In-person surveyors came, which has been a tough thing to do throughout COVID-19. So really pleased we're able to do that in person and really take a very close look, and proud of the team and happy that we were able to show a level of accomplishment that earned us that reaccreditation and some real notable positive feedback from the surveyors. We've also been doing some important recruitments relative to bringing physicians to the community, and through our work between Good Sam as well as our Samaritan Medical Group, we are welcoming some really noteworthy physicians. I get the privilege of getting to interview a number of these physicians as they're exploring opportunities with us. So you can see the list here, but a brand new breast cancer surgeon coming to our community, cardiologist, 2 orthopedic surgeons, and I'll highlight Dr. McCrum because he actually is the new team physician for the Oregon State University football team. And Dr. McCrum does some great work in terms of joint replacement, a lot of knee repair. So really excited to have him here along with our other new physicians, Dr. Shirley, Dr. Dillon, Dr. Mirish. Dr. Matabushi is very notable because she is our very first, in some time anyway, if ever, first board-certified vascular surgeon. She comes to us from St. Vincent in Portland. So really excited. She started January 3rd. She was ready to roll and providing really specialized care for those who are suffering from vascular issues. Dr. Proboznik joined us as another member of our infectious disease team. So great to have her. We have really benefited from Dr. Adam Brady and Dr. Sugat Patel as key members of our infectious diseases team. So now to have Dr. Proboznik here Obviously, with COVID-19, even though I want to talk about other things, we still have to make sure that we're ready to manage that as it continues to evolve. Kind of back to that story about the flu. The flu didn't fully leave us either. So these are things that we need that expertise to help manage it. So very excited about adding another physician to that team. And then a new certified nurse midwife with Barb Torres, so very happy to have her on board. And then I do want to just touch on the fact that I'm very proud of the partnership that Good Sam has had with Benton County Public Health and Oregon State University and all of our vaccination efforts. It took all three of those organizations to vaccinate tens of thousands of individuals throughout Benton County. And then at the same time, our hospital did recognize a number of community-based organizations with $150,000 in social accountability grants for 2022. And speaking of vaccination efforts, I said I was going to move on from COVID-19, but it doesn't let us go quite yet. This was when we celebrated 30,000. Now it is well over 50,000, but when we got to the 30,000 mark, because we did all of our community-based vaccination efforts with Benton County Public Health and Oregon State University at Research Stadium, it was cool. So just really had to show how that looked, and this is labeled before because there was an after because we knew there were going to be more folks being vaccinated, but important to celebrate those milestones. So that was a very positive one. Also wanted to touch on a few other things that we've accomplished, and again, kind of not losing the lesson of how we need to manage in this new reality of where we find ourselves in healthcare. But there are also foundational things that we cannot lose. And one of those things, and it makes Good Sam very unique, we are one of the very few hospitals actually in the nation that still maintains its own privately run, managed, hospital-based guest house, if you will. So for those of you who may not be familiar, we have our Mario Pastega house. We've had it for a number of years through fantastic contributions from Mario Pastega himself when he was living, and now, of course, with the Pastega family. So very grateful for their support. They were key supporters, along with many other members of our community, in doubling the size of the Pastega house. So just to give you kind of a quick sense, just a couple of snapshots, we added 12 more rooms, so now not just the original 12, but 24 guest rooms. We provide this to loved ones who are coming here with their family, their loved ones who have to get treatment, or if someone ends up in our emergency room and a family member, loved one, or the patient post-discharge really needs a place to stay. We provide this either free or at very low cost. Now it has 2 kitchens, laundry facilities. It's just a tremendous resource, not only for our community, but for the entire state. So really happy that we're putting the final touches. This will be opening in early 2022. Supply chain challenges, unfortunately, we're not immune to that either. We're waiting, and that's why I put the beautiful snapshot in of one of the guest rooms, and the beds aren't there yet, but we know they will be. And when that happens, we will be celebrating that and inviting folks when it's safe to come take a look and see what a wonderful resource we're able to provide. So foundational thing that we cannot lose. I also wanted to brag on our OB department. We had gotten this. 2020 is actually the most recent data set available, so they just released this at the end of 2021. And Good Sam scored a 90 out of 100 for our OB unit in terms of patient-centered care, our newborn feeding practices, and just kind of well baby and well mom care. So really proud of that. And I would highlight here that the average score within this survey, which is a Centers for Disease Control and Prevention study, they rank and evaluate and score hospitals throughout the United States, and that average score for U.S. hospitals is 81. The regional average is 85, and then similarly sized hospitals is also 81. So for us to score 98, I'm just really proud and got to brag on our team and the OB unit. Again, very foundational part of what we provide. And then I wanted to provide a little bit of insight, additional insight as well. Many of you have probably heard about readmission rates. So we target, these are some patient experience scores, what we do in our ER, and this is just kind of a smattering, but I think it gives you kind of a good sense of what we're focused on internally, what's important to someone like me in this particular role. So 30-day readmission rate, something we take very seriously, and I'm really proud to share that we have a target of 15.6%. So 15.6% of our total discharges being readmitted within a 30-day period. We're actually at 5%. So well below our target. So really proud of that. We'd like it to be 0, but this actually captures if you come in for surgery and you're readmitted for any reason within 30 days, we're going to capture that. So to have it at 5% is really noteworthy. Then likelihood to recommend, the next 3 measures, the likelihood to recommend, communication with nurses, and communication with doctors. This comes from the HCAHPS, which it's a tough acronym. Let's just say this is the Patient Experience Survey, and this is based on patient experience surveys that go to our discharged patients, and so this is how they're answering those questions, not us. And then we hold ourselves up against hospitals throughout the country. Our target is to say, you know what, we're doing all right, 50th percentile, and the fact of the matter is that for the most recent data available, which is October, we are in the 77th percentile for folks who are likely to recommend us, and so that indicates that only 23% of hospitals rank better than us. Communication with nurses, even better, at the 98th percentile, so only 2% of all hospitals score better than we do, and communication with doctors, don't want to leave them out, 81st percentile. So, and all of this, again, in the midst of COVID-19, and that actually nationally has pushed patient experience scores down. So really proud of the fact that we've been able to excel during this really challenging time. And then ER arrival to discharge. I'm sharing this not because we're reaching our goal, because our goal is to have an ER patient arrive and be discharged in less than 146 minutes. We're not there yet. We have a very busy ER. We want to move folks through safely, quickly, appropriately, and in a patient-centered way. What I am proud of is as we've seen month over month our ER volume increase, we've been able to month over month decrease that ER arrival to discharge time. So we're currently at 188 minutes, want it to be lower, but still pleased to see that we're under target on that. And it's going in the right direction. We also were recently recognized by Healthgrades, which is a national organization that evaluates 4,500 hospitals throughout the country. We were given the top honors, 5 stars, for treatment of heart failure patients and treatment of heart attack patients. So this is really a testament to our Samaritan Heart program, our cardiologists, our cardiac surgeons. So really pleased that we can show this level of performance and the guidelines that we have in place, how we treat our patients, how we staff to treat those patients. We know that having that level of expertise available, that level of commitment saves lives. So it's great to get this public recognition of that commitment and accomplishment. We also just received word that we recertified, so just as we recertified our entire hospital, we also recertified our stroke program. That's a program that's been in place here since 2007. We're recognized as a primary stroke center, so again, we know that time is absolutely of the essence in treating strokes. So for us, this again is kind of that next level in terms of our commitment and maintaining that commitment. So proud to kind of hot off the presses share that we were recertified with our stroke program, and great to have that available locally. And kind of part and parcel of the heart program, we continue our partnership with Stanford. We have 2 Stanford faculty members who are here as our cardiac surgeons, Dr. Garra and Dr. Bender. So very proud of the work that they do. They've continued to provide heart surgery procedures, surgical procedures throughout the pandemic. Even as we've dealt with staffing shortages like hospitals all over the country, we've been able to maintain that. Stanford's continued to support us with our program. So very excited that they've been able to continue open heart surgery, as well as TAVR, which is the transcatheter aortic valve replacement procedure. So part of the reason why we were recognized with that 5-star performance. So now we're really getting down, and I'm going to stick with time, so I'm just going to move through this very quickly because I want to make sure we've got a few minutes still for questions. But I just want each of you to know that 2022, we will continue to manage, of course, the pandemic, but we're going to grab as much time as we safely can throughout this year to think about what do the next 3 years look like for Good Samaritan Regional Medical Center, what does healthcare look like in our community, and we are actually doing a joint 3-year strategic plan with our Samaritan Medical Group as well as Good Sam Regional Medical Center. So this will really drive what level of commitment we make with our services, what do we want to reinforce, what do we want to enhance, what do we want to expand for 2023, 24, 25, and really beyond as well. We have property across the street that is referred to as our North Campus. I'm actually going into a North Campus planning meeting right after this presentation to talk about how do we want to best use that property for our community? What are the services? What gaps may we have? And then also looking at how we want to continue to reinvest in our graduate medical education program. Hopefully you're familiar with the fact that we actually, believe it or not, have the second largest hospital-based education program for medical residents and fellows in the state. I actually think I got that number wrong. I think we have a few more than 112 residents, fellows, as well as medical students in our hospital every day. So really proud of the fact that we're not only educating these physicians, many of them are staying in our community. So key part of why we're able to provide excellence. And then just important to share with you that as part of our strategic planning effort, we'll be reaching out to the community. We're just at this point starting about how we want to lay this out over the next year. So a lot more to come on this. And so really just building on our current mission, vision, and values, we will not be straying from that. Growing healthier community, building healthier communities together is what we're all about, and we will not move away from that. That will be a part of our plan. And again, those 4 key areas, quality and service excellence, our community partnerships, sustainability, and employee engagement. And so this just, again, kind of reinforces how what we're doing on the right-hand side, the detailed work of goal setting. You'll see that North and Main campus on the bottom right there, kind of new space as well as existing space. This is kind of the nuts and bolts of what us hospital types do, really thinking through what our services need to look like. I'm not looking for a solution in search of a problem. We want to identify the challenges and solve for those. We have done some kind of just very high-level initial polling internally. We want to get a sense of kind of, again, directionally, where do we need to go with some of these discussions. So this is a screen grab from one of the kind of voting surveys we've done with our Good Samaritan Regional Medical Center board that we have done with our managers, and now we've done with our employees. So we're starting internally, and then we will move outward. But this is just an active way of really getting folks engaged in the conversation. And you'll see on the right-hand side, kind of midway, we still have semi-private rooms, and you would think it would be easy to move from semi-private to private rooms, all private rooms. It's not. It will take a significant amount of planning, especially when you've got a full hospital, and we have a full hospital. So thinking through what that may look like. So what our employees, our board, and our managers told us is that, you know what, this is a really high priority. We're not saying we're only going to work on one thing, but this again kind of just let us know priority-wise, internally, what are folks thinking about the most? And that is the thing that they're thinking about the most. And then we queried them on what are you thinking about in terms of service lines? Where do we need to go in terms of developing, enhancing, expanding some of our key service lines? And so these are some of the discussion points we'll be taking out to the community. So in this one, a little bit closer, and right now what folks are telling us internally is they would really like us to do more development work around a surgical oncology service line. We have comprehensive oncology services available now, including oncology, but to get further expertise relative to surgical oncology, so that's something that we will be doing. I anticipate we will be doing a lot more follow-up on. All right. So that brings me to the end of my formal remarks. I know we just have a few minutes, But really, what I'm committed to is we talked about resiliency, health, and hope, but taking those lessons, keeping those lessons, don't want to lose the lessons. How do we redefine health and hope? Starting in 2022, I want to continue the discussion. I hope each of you will have the opportunity to give us input as we move through this year of planning. And while it didn't start out quite the way we wanted it to, we are going to still eagerly find those ways that we can continue the discussion about what the future looks like and what we want healthcare to look like in the future for our community. So Tiffany, with that, I will turn it back to you and happy to field any questions or comments.
All right, I'm looking in the chat. I don't see anything. Does anyone have a question from our audience? If you'd like to raise your hand, I can call on you. All right, I'm not seeing anything.
All right. Well, I just want to put the open invitation out there that, oh, I see a hand up.
I do as well. And Nancy, if you want to come off of mute, go ahead.
I'm going to miss saying that when we finally get back in face-to-face here. That was a great presentation. Laura, I'd like, could you follow up just a little bit when you said you were going to go out and kind of query the community? What options do you think would work? I know we have to deal with COVID right now, but down the line a little bit.
Yeah, thank you, Nancy. So I think that we have an opportunity to really structure what that should look like. Based on my experience, I fully anticipate that we will find opportunities, whether that's through some of the community through key community organizations. I anticipate we probably would want to identify some focus group opportunities. I had the chance to attend a neighborhood meeting kind of before Omicron really hit, but I did have the chance to go to a neighborhood meeting in our neighboring Fentonwood neighborhood, and even though we were talking about traffic, so of course they wanted to talk about the hospital, I was glad I was there, and it actually was a very positive interaction, and I appreciated the opportunity to stand up and answer any questions or field any comments. But to me, that was the perfect forum. You know, folks who, in this case, live nearby, and obviously they may have a little bit different take in terms of the input that they would want to provide. But to me, identifying those opportunities, whether it was through some neighborhood groups, community-based organizations, and then us identifying some focus groups. So to say, you know what, we want to make sure that we talk with maybe folks who fall into a younger segment, those who may have children, those who may be part of, more mature patient cohort. So we get a really good cross-section, because I think sometimes, too, we hear the louder voices, and we really need to hear all of the voices. And while that won't entirely drive our strategic plan, it definitely needs to influence it. So to me, that's something that definitely will need to work out with our board of directors, as well as our internal team, but to me, critical part of our strategic planning process.
Thank you, Laura. I enjoyed your presentation.
Thank you, Nancy. Well, I just want to thank everyone again for your time and attention. It's always a pleasure. Again, kind of talk about lessons learned, and excited about looking forward. So I appreciate everyone's valuable time today.
All right, thank you, everyone. And if you want to find out more about WISH, please visit samhealth.org/wish for event information and membership information. Thank you so much.
Thanks, everyone. Have a good rest.